one of the biggest issues is just the absolute growth in home care in the United States. Over the last 30 years, it's grown from 50% of all healthcare to 70% of all healthcare. And that's mainly because of the just blossoming baby boomers all becoming elderly. Many of us have parents at home that are elderly, and after you get over the age of 70 or so, you have more chronic conditions, more issues. So that growth in itself is causing a real issue with home health agencies trying to carry the load. Like most of healthcare, home care is also having a staff shortage. And that's primarily due to the burnout of the role itself, because it's a very lonely role. You basically are going from house to house and doing home care, and you have very little contact with the rest of your team. In fact, you feel basically like a loner. Because of that, amazingly, the home care industry in the United States has a 65% turnover rate annually. That's 2/3 of the people turnover every year. And that costs you about $5,000 per staff each time that turnover occurs, in terms of doing the hiring and doing the training to get them up to speed, which is an amazing cost. So trying to identify how we can improve the role and the morale and satisfaction of those employees so we keep them longer would have a huge benefit, mainly because we just need more and more of them to take care of the huge burden we have. The other issues are, like most of healthcare, there are reimbursement pressures. Some of that's driven by the fact that in the United States, home care agencies are very small. The average home care agency only has about 1,000 patients or so. And that's leading to probably the other big trend, which is national players. Major retailers like Amazon, Walmart, CVS, which are big pharmacy players, are actually entering and buying up home care agencies, the major national players, and the national players are just consolidating and growing bigger and bigger. So we're seeing a transition from the small sort of family-run home care agencies to very large national agencies that are aligned with some of the key retailers who are trying to get into the home-based and consumer-based care market. So for the players in healthcare, moving from the acute care hospitals into home care is not only good for the quality and access of care for the patients, but also for their own bottom line in terms of the margins. And that's why so many of the major retailers are really moving into home care and competing against hospitals and health systems for home care. Polls have shown too that consumers, patients, really focus more now on convenience, access, and value for their money, rather than sort of the quality of care and the relationship with physicians. And that's made a big difference. It's moved from institutional care to really individual-focused care and consumer-based care. So what we're trying to do is help physicians get into the home more effectively. And that's what Hippo does. Hippo allows physicians to work remotely by working with a caregiver at the patient bedside. And if you haven't seen the device we use to do that, it's a headset that you put on and basically allows a physician who's remote to work with you, a caregiver who's working with a patient. And so we allow a physician to feel more comfortable working with a clinician in the home to work directly with a patient. That really improves the overall care and overcomes some of the care delays, the quality deficiencies, and the staffing deficits that are the barriers to home care.